Hi, this is Dr. Keanu Shah from Desert Dream Dentistry and Spa. Today we are doing a patient testimonial from a very good friend of the practice that has been coming to us for some time now. This particular case has been like a medical phenomenon for us, where we were able to correct things that weren't able to be corrected for the past 2 years with the wonderful new techniques of PRP, stem cell treatment, concentrated autologous growth factors, and bone grafting. I'll go ahead and let Jamie speak on the topic and tell her story, and thank you for doing this for us today.
Thank you. In 2017, I developed a submaxillary abscess which had to be drained. It was a strep abscess. I developed a fistula from that. I was treated with IV antibiotics, actually hospitalized during the time, but treated with IV antibiotics for approximately 2 weeks. The drainage persisted for another 2 to 3 months. In November of that year, I went back to the oral surgeon, who actually went in and saw that on the CT scan there was a lot of dead bone that needed to be taken out. He proceeded to take the dead bone out and did a biopsy. The biopsy at that time, because of the abscess and the infection, showed chronic osteomyelitis. He felt pretty certain that once the bone was removed, that the fistula that developed there would close up and the drainage would stop. The drainage never did stop. Several months into that, I was sent to the infectious disease department at Eisenhower Hospital, who proceeded to place me on IV antibiotics for 3 months with the hopes that this would clear the infection and stop the drainage. This lasted for approximately a month after the treatment ended with the antibiotics. The drainage returned. Since at that time I was referred to Loma Linda Ear, Nose, and Throat Department, which wanted to do an extreme invasive surgery to close the fistula and put in new bone by taking bone from either my femur or from my shoulder. I felt that was too invasive, that there had to be something else that could be done. I came to Dr. Shaw, who has worked with me now for the past, I'd say, 1.5 years on the problem, with doing stem cells, the PRP, plus going in and doing bone grafting. There's complete resolution of the problem. I have had no more drainage. The area in my neck has completely closed. It feels perfectly normal now. I am just so grateful, because I thought that this was never going to end.
That's wonderful. So soon you're going to be working on implants. You're waiting for some additional healing to occur. So this is the area we had copious drainage that also led to the osteomyelitis in the bone. It was clear that where the source of the problem was, and the source had to be eliminated, and also a quick healing procedure with PRP and stem cells and all of that good stuff that we will be covering in our lectures. Well, thank you, Jamie, for doing this wonderful testimonial for us and becoming a great patient of the practice. Everybody loves you around here, and we hope that you keep continuing to come to us for your care.
I will be here because I'm so grateful that it's finally resolved.
Thanks so much.
Thank you.